about breast implant removal surgery, which is also called explantation. Patients do not need to be fasting. We will offer patients an oral anti-anxiety medication, some laughing gas, and we have a really friendly all-female team, nice warm bed in the operating room, and we play whatever music they like to listen to. After we inject numbing, we open up the scar if they already have one or make a new incision, usually about an inch and a half long. We slide the implant out, and then I usually have a look around on the inside with a device that's called a lighted retractor. If we see anything unusual, like inflammation or excess scar tissue, I usually take a sample of the scar tissue on the inside, which is called a culture, and we will send it to the lab, often looking for bacteria, or on occasion, if something looks unusual, we will send it to the pathology lab. And usually we do not need to remove all the scar tissue around the breast implant, and that's called a capsulectomy. Reasons to perform capsulectomy include a severe infection, cancer, or if the patient has had severe capsular contracture where the scar tissue is so thick, sometimes it can be as thick as a grapefruit rind. If we felt that removing the implant but leaving that scar tissue behind would create deformity, then I might recommend removing it. But for the average patient who just doesn't want her breast implants anymore, we can just leave it alone. And after we remove the implant, that scar tissue kind of fades away because it has nothing left to rub against. Patients can shower in 2 days. They can exercise in 2 weeks or whenever the bruising is gone. They usually are really happy that they don't have to go to sleep. They don't require all the anesthetic drugs and postoperative nausea. They actually know what was performed. They won't see anything while we're working because we can cover their eyes, but they really feel ownership in the surgery. And it is amazing how rapidly the breast will naturally contract because the breast is naturally a distensible organ.